Right, thank you very much for coming. The reason why we've put this on tonight is because there are a lot of strangles outbreaks at the moment in West Yorkshire and North Yorkshire area. Had a message yesterday confirming the 8th yard that is suspected of having strangles. We usually see quite a bit at this time of year, but this is quite a large number. So we've tried to invite as many people from different yards as we can, just to give you a bit of information about that. Right, next problem is getting this to... there we go. Okay. Right, so a little bit about the actual strangles bug itself. It's a bacteria, not a virus, as some people commonly think. It's quite a small bacterium, and it causes respiratory disease in equines only all over the world. Its very grand name is Streptococcus equi var equi. And just a little bit of an explanation of what happens when your horse encounters strangles. First of all, the bacteria will attach itself to the mucosa in the lining layer of the nose and throat. It invades through the cells of the lining layer and gets into the lymph and into the blood supply. It will avoid the horse's immune response in the early stages, gets into the lymph nodes, and that is where we find these abscesses. It also does some damage to the lining mucosa, and we get an invasion of white blood cells and pus, so we get a snotty nose. But the common sign that we see associated with strangles that everybody's familiar with is these abscesses of the lymph nodes. Now, strangles is a highly contagious disease, and so they're up to 100% of horses in a group that are exposed to strangles can be affected. But the severity of the disease varies quite widely. Some horses, as we'll see in a minute, only get very mild disease, and in some circumstances it can cause such severe disease that it kills. Now, the fresh bacteria from the abscesses or from the pus in the coming from the horse's nose is the most hazardous in terms of contagion. So fresh bugs directly from the horse, and it is spread by direct horse-to-horse contact. It's not spread by aerosol contact. Flu viruses, for example, equine flu, the flu viruses are much smaller than bacteria. They will become aerosolized in small droplets of liquid that come out when the horse coughs, and those can spread up to 120 meters and infect horses a long way away. The bacteria are much bigger. Obviously, the muck and snot that's coming out of your horse's nose is fairly sticky and heavy, and tends to sort of stick to the nearest object. It's not going to travel very far. So it's direct horse-to-horse contact, direct contact with the pus and nasal discharges. Also spreads on people's hands and clothing, and also on tack, so bits, head collars, buckets, that sort of thing. A very important source of disease is water troughs, and we'll say a little bit more about that later. So how does the disease progress? Well, the horse usually doesn't react very much for the first sort of 2 to 3 days, and then they will get a fever, and it's at that stage they will start shedding bacteria in small numbers, and that will increase as time goes on. Now, the actual discharge, in terms of discharge from the nose, that might start around about sort of day 3, day 4, and it can be up to about sort of day 14 that we start getting the abscesses formed. So once these horses start to get abscesses in their glands, they've been not only infected for quite some time, but they're also shedding bacteria already. But we do have a little window of opportunity at the beginning there to catch these horses early and hopefully nip things in the bud. And again, I'll go into that in a little bit more detail shortly. Down at the bottom there, changes in blood. We can see raises in white blood cells and antibody responses from anywhere from about sort of day 3 onwards. And when we get to the bit about testing for this disease, I'll go into that in more detail. So classical strangles, which everybody's probably familiar with, lymph nodes around the head and neck. Here on the left-hand side there, you can see a draining abscess from this horse's submandibular gland. Another one there where it's broken out in several different areas. This horse has had some the retropharyngeal lymph nodes affected, the glands in the top of the neck here, and this one at the bottom here. So any of the lymph nodes that drain the respiratory tract in the head and neck can be affected. The word strangles comes from the fact that some of these horses have difficulty breathing, and this is because the abscesses, as well as sort of blowing up and appearing large on the outside, particularly these submandibular abscesses, can also grow and cause problems inside as well. And that's more typical of the ones in this area, the retropharyngeal ones. And this is an X-ray of a horse's upper neck. These are the neck vertebrae here. These are the jaws here. The line down here is air in the trachea. And this here is the air in the guttural pouches, which we'll mention in more detail in a minute. Those are a diverticulum, the horse's eustachian tube, which is unique to equines. And if you look at this this part here, this mass here is actually an abscess in the horse's neck. And you can see there how the wall of the trachea is being pushed down by this abscess. So it's actually pushing down, closing off the horse's trachea, making it very difficult for that horse to breathe, hence the name strangles. And a lot of these horses will have real sort of stridor, make a real sort of noise and increased respiratory effort. This is a picture of a horse here. You can see it's got very flared nostrils, having difficulty breathing. This is an endoscopic view of the horse's throat, and this is the epiglottis here, the front part of the larynx. And normally there will be a nice big black space there, the entrance to the windpipe, and this here is the abscess that's encroaching on that and nearly blocking off the horse's airway completely. Now, if we have a look inside this horse's guttural pouch, this is the floor of the guttural pouch, and again there's a great big swelling there where the abscess is encroaching into that. And some of these horses we need to put a breathing tube in, a tracheotomy tube in there to bypass this obstruction so that they can breathe. But fortunately that doesn't happen very often. It's not a very nice job when you have to do it with a horse crushing around that's going blue and panicking basically. Just want to say a little bit about carriers. The sort of reservoir of infection in cases that are carriers is very important in transmission of the disease. Normally in sort of humans and cattle and pigs and dogs and cats and things, they have tonsils in their nasopharynx. In horses they have their tonsil-like tissue spread over the entire sort of roof of the throat, so it's quite different anatomically. And as we mentioned just now, there's this anatomical difference in the guttural pouches that people don't really know what the function of the guttural pouch is for, but it does serve as a very handy carrier for Strangles organism, unfortunately. A lot of the horses that get guttural pouch strangles infections don't show any signs at all, so you can be completely oblivious of the fact that your horse is carrying and indeed shedding Strangles organism. Sometimes you can get pus in the guttural pouches and you might get an intermittent discharge from one nostril, or they can get what we call interspated pus, which is like sort of cheesy or even sort of rock hard stones of pus called chondroids that sit in the guttural pouch and can stay there for years. They shed bacteria continuously in small areas, in small numbers rather, and the bacteria are released into the nasopharynx and then come out via respiratory secretions and are spread to other horses, often in water troughs. I got involved a while ago with a friend of mine that practices down in the West Country, and they were dealing with some Strangles outbreaks in the Exmoor area, and there were 3 or 4 very good livery yards down there. They had excellent control measures in place, and they couldn't understand why they were getting outbreaks of strangles from time to time. And it turned out that the source of this infection was actually water troughs on Exmoor. Strangles is endemic in all the native herds, the Dartmoors, the Exmoors, etc. And these ponies go up to the old water troughs and watercourses on the moor for a drink. And unfortunately, these people were taking their horses out for a hack in the beautiful countryside on Exmoor. Why wouldn't you? And on the way back, they'd often stop at these water troughs and let them have a drink. And unfortunately, as they were sharing the same water source as these chronically infected ponies on Exmoor, they were picking up the infection and bringing it back into the yards. How do we define a carrier? We define a carrier as a horse that continues to shed bacteria for more than 6 weeks after recovery. And that carrier state can persist for months or even indeed years. And there's a few pictures again inside the guttural pouch here. This is a very fortunate photograph which was taken by a colleague in London with their video endoscope, and they put the endoscope in their guttural pouch, and there was a little bit of muck in the bottom of it. And then this is an actual sort of action shot of the abscess here bursting into the guttural pouch. So this is the pus spurting out into the guttural pouch from this abscess in the floor of it. There's a more mild case here. This is again the guttural pouch here. This is the stylohyoid bone coming down the middle, dividing it into its lateral medial compartments. And this horse has got a few sort of flecks of fairly thick pus and a little pool down here. This is the other extreme, where you've got these great big clods of quite cheesy pus sat in there, almost obliterating the whole of the guttural pouch. And these are pictures of the chondroids, as we call them. Nice picture of the guttural pouch there. There's the internal carotid artery there, and some of the cranial nerves that pass across the floor of the guttural pouch, and these can get damaged in these cases due to the inflammation in there. So that's a surgical pot from an operation where made an incision into the horse's neck and pulled some of these chondroids out through an incision. You can actually take them out endoscopically with a sort of basket snare if they're small enough as well. And that's just another example in the corner there. Strangles can cause other complications as well, what we call bastard strangles, where it gets disseminated to other parts of the body, and it can literally spread in the blood and lymph to any other lymph nodes or any other organs. We more commonly see it in the lymph nodes or lung in the chest. It can cause peritonitis. We can get abscesses in the abdominal cavity or in the liver, spleen, for example. There's been cases documented where it has spread to the brain and spinal cord, into the eye, joints, tendon sheaths, the heart, causing myocarditis and endocarditis, pericarditis, in the muscles, and even into areas of bone as well. So if you're unlucky enough to get the disseminated form of disease, it can be very nasty indeed. A couple of other important complications. If we think back to those pictures of the guttural pouch I showed you, there's 3 very important cranial nerves that go across the floor of the guttural pouch, and those can get damaged, and those help control the muscles of the tongue and the throat and the larynx. So we sometimes get horses which are dysphagic, they can't swallow properly, and sometimes, as in the case of this horse, the larynx becomes paralysed and they can't open and close their airway. So they make a horrible noise when they're exercised, and they may also aspirate food material and get chronic infections in the case of this one. There's another condition called purpura hemorrhagica, which is an autoimmune reaction to the antigen and antibody complexes going around in the blood, and that can cause horrible lesions in the mucosa and skin. So we get these areas of skin necrosis. You'll see this horse has lost quite a lot of the skin from its coronary bands to its fetlocks, and it's also typified by swelling of the limbs and ventral edema. It's an uncommon complication, but if this does start to appear, it's very important we jump on these horses very quickly and start fairly aggressive treatment to try and get on top of this, because once it gets away from you, the success rate of treatment is quite low. Death rates, some of the American studies quote death rates up to 10%, and that's quite unusual in our country, and it's usually less than 1%, but there have been a couple of outbreaks in the UK that have recorded mortality of up to 3%. Now, I want to really focus tonight on the mild strangles disease, which is often called atypical strangles, which is a bit of a misnomer, really. It's because it's much more common than the severe disease. A lot of horses will show no clinical signs at all, but it's very important to understand that they are still capable of spreading disease, and they can still become carriers. So instead of these abscesses and snotty noses, you might find the horse is just a bit off colour for a day or two, might have a spike of high temperature, just not eat its tea or something like that, and then be back to normal. If we can get this picture in our mind of the iceberg, these horses here with the abscesses and horrible snotty noses and coughing, these are the ones above the water, and the atypical mild cases are all these ones below the water, which make up the bulk of the iceberg. So it's important because it doesn't look like strangles. Basically, if we go and see a horse that's got a great big abscess under its jaw that's about to burst, and it's got a temperature of 104, we quite often go by the adage that if it looks like strangles, it's probably going to be strangles, and some of those, it's not even worth testing them to confirm. Although, it's ideal if you can get a confirmation, but there's very few things that will cause those signs. It just looks like any other respiratory infection. Samples are not usually taken from any of these horses to identify the bugs in culture, and because everybody thinks they're fitting well and they've got away with it in their yard and their horse is fine, they are either fairly haphazard or don't bother implementing any control measures at all. The atypical isolates are probably the more important horses in spread of disease, and the bugs can still cause severe strangles in other horses, and unfortunately outbreaks often go unrecognised in the atypical milder cases for several weeks until we start to get the odd more severe case occurring, and that can result in a very confusing picture if the disease has been circulating in the yard for some weeks, but nobody's been able to recognise it. So where is the disease? Where does it come from? It used to be thought that horses with strangles would release a lot of snot from their nose or pus from their abscesses, and it would stick on gate posts and goodness knows what, and would survive for weeks and weeks and weeks. Fairly recent work has suggested that its survival rate outside the horse is actually quite low, and if you get a day like we've had today, where you've actually got a bit of UV light for once, the survival rate will only be for sort of 24 to 72 hours, so 1 to 3 days. In sort of more cooler, duller conditions, it can last up to about 14 days. Water troughs, however, are another matter. And again, this going back to the ex-war experience, these are a very important route of infection, and we must consider those quite carefully when we're thinking about isolating horses, and also if we get trying to manage an outbreak. So the organism has been shown to live for at least 28 days in water troughs. And again, the main reservoir is these carrier animals, which will shed the bacteria more than 6 weeks, but this can go on for many years. So next question, is my horse at risk from strangles? How do I decide whether I should be taking any precautions or not? The vaccine company that make the the Strangles vaccine, put together this which I think is quite helpful, where if we think of this sort of going from cool to hot or low risk, where disease is unlikely, through to high risk where disease is more likely, and they put a few factors that we need to consider there. So number of horses and owners. If you keep your horse at home and there's one horse on the yard and you never take it anywhere and nobody brings any horses to visit you, you're very unlikely to get strangles. So on the sort of top gear cool wall of strangles, you're going to be over here somewhere. If you're in a big livery yard with 150 horses, and there's somebody that goes and buys horses from York Sales, has managed to persuade the livery yard owners to let them borrow 10 of the boxes right in the middle of the yard, and they've got horses coming and going all the time and this sort of thing, then you're going to be up this end. So size of yard is important, how much contact the horses have with other horses as well. So again, if you're at home or you're just on the yard and you just tend to stay there, then obviously you're more low risk. But if you've got a lot of contact with other horses, if you're going to a lot of shows and competitions, for example, then your risk is going to increase. Some yards will be fairly closed yards, and they'll have very few new arrivals. The sort of population will be very stable. Others, you've got a high turnover and you've got people coming and going all the time. And again, low number of new arrivals, you're down here. Yards with a high turnover, you're going to be a lot more at risk. Previous strangles outbreaks. Have there been other outbreaks? Were they investigated? Do we actually know if any of the horses on the yard are carriers? Do we know how many that people thought had got away with it were actually showing the mild form of disease and were possibly carriers? So again, that's history of the yard and any previous outbreaks is quite important to consider. Whether there's any preventive health plans in place, whether there's any quarantine measures in place. I just ask, how many people here keep their horse on a livery yard? Just pop your hands up. Most people? And how many of you either work on a livery yard or are livery yard owners? We've got the owners here tonight? Right, okay. Right. How many people would have a quarantine plan in place for their yard? Just pop your hands up if you've got a quarantine plan in place. Nobody. Right, okay. Right, okay. Water and feed management. This is quite important if horses are sharing water sources, if they're sharing feed buckets and what have you. And then personnel movements. Are the horses divided into different groups? Are the people moving towards those groups? And general other sort of biosecurity measures, which we'll talk about in more detail in a moment. In fact, now, so controlling strangles. What can we do to keep the bug out of the yard if you want to have what we call a no tolerance attitude to strangles? We're trying to encourage people to work closely with their vets, because we will be able to give you quite simple advice. Everybody thinks it's very onerous when we start talking about having isolation facilities, and everybody starts thinking about everybody gowning up and putting masks on and boot dips and things like that, and having the horses in a separate unit. Well, it's actually quite simple to put in some very basic biosecurity measures that will protect you from, particularly from strangles. It's not that difficult. So if you can change your management, particularly of horses that are coming into the yard, then that's going to help you keep the bug out. So what sort of procedures can we put in place? Well, quarantining and testing new arrivals into the yard is the obvious one. We've kind of changed our procedures here through the sort of new knowledge that's been gleaned about strangles now, and we now like to isolate horses for 3 weeks here rather than 2 weeks, and after either, if we don't know where they're coming from, either before they arrive or after 14 days, then we'll take a blood sample from them to test for strangles antibody. So that's helping us identify possible carriers carriers or horses that have been exposed to the infection. And obviously you want, if you're going to have a low tolerance policy to strangles, you want to identify any carriers on your yard and obviously don't let any new ones in. Minimising the impact of the bug if you do get an infection. Think of the group as a herd, not as individual horses, and use vaccination to maximise the immunity of the actual herd. It's quite important when we think about vaccination to consider populations, not individuals. A lot of the work that's been done in humans, and in fact all species, suggests that if you get more than 70% of the population vaccinated against the disease, then you'll get pretty good protection against the disease in that group. If you get a lot less than 70%, then you'll get some benefit, but it won't be ideal, because you'll still get quite a lot of spread between individuals. The idea is that you kind of isolate the unvaccinated horses by surrounding them with vaccinated ones, and then those will get the disease. The vaccine doesn't stop them acquiring the disease, but it enables the immune system to recognise it quickly and to deal with it and reduce the clinical symptoms, and that includes massively reducing the amount of shedding of bacteria, and that will reduce the spread. So vaccination will help reduce the spread of the infection. So do we just think that strangles is a fact of life and we have to live with it? Well, in some cases, yes, we do. And this again goes back to the sort of risk profile of the yard. If you are in a yard which has got a lot of people coming and going to a lot of competitions, or if you're in a yard where there might be a dealer in part of the yard, has a lot of horses coming and going that might be coming from some possibly dubious sources, then you're never going to be able to eradicate the risk of strangles from that yard. And we do have to then sort of think about a lot of other strategies to try and minimise the impact rather than trying to get rid of it, because that might be impossible. So we start to think about grouping the horses, limiting the movement of the horses on the yard, quarantine and testing new arrivals, biosecurity controls. So you've got to make up your mind yourselves as livery owners, horse owners, or livery yard owners, as to whether you're going to have a zero tolerance approach or whether you're going to have a tolerance approach. And the two approaches are quite different. You need to make that decision that's appropriate for your yard, and I would suggest you talk to your veterinary surgeon to decide what's going to be right for you. So when we try and prevent strangles, we go back to this risk base, zero tolerance. We will try and eradicate it and stop it coming into the yard. Tolerance, we'll try and live with the disease, and part of living with a disease might be vaccination programs to try and control the spread and limit the extent of any outbreak. Now, Equilus Strep E used to be made by Intervet, which then became Intervet Sharing Plough, and I think this week they're Merck or MSD. Hopefully there won't be any more takeovers in the near future, but these pharmaceutical companies do seem to change hands quite quickly. Now, this vaccine was on the market, it came on the market either 2006, 2007, and it was out for a couple of years, but it was then withdrawn from the market. And there's quite a lot of misconceptions about the vaccine, and people saying, oh, it was taken off the market because it didn't work, or it gave horses strangles and that sort of thing. And I've sort of talked to the company in some depth about this, and as I say, there was a lot of misinformation at the time. There was unfortunately some rather bad press about a couple of problems with the vaccine in a couple of yards in the Midlands just before it was taken off the market, which was bad timing. There was a lot of noise made about those, but these involved misuse of the vaccine rather than there actually being a problem with the vaccine itself. One was a horse that had had a flu and tetanus vaccine given at the same time as the strangles vaccine. And Strangles vaccine is given in the upper lip, in the mucosa, and the flu and tetanus vaccine is given intramuscularly. And it says specifically in the data sheet, do not give any intramuscular vaccines at the same time, because this is a live vaccine. Some of it will get into the blood and lymph, which you want it to do, and it may travel then to sites of tissue damage, which includes the site of intramuscular vaccine administration. So this particular horse developed an abscess at the site of its flu and tet vaccine. That was then lanced and swabbed, and surprise, surprise, they drew strangles from it. Now, the other case was basically a horse that was vaccinated, and nobody had told anybody that there'd been strangles circulating in the yard for anything up to about 6 weeks before. And this just illustrates the point that it's very, very important for people to be very open and honest about strangles if they're going to get it under control and actually resolve outbreaks, rather than trying to cover it up and pretend it hasn't happened. So how do we use the vaccine? The primary course is 2 doses, 4 to 6 weeks apart, and normally horses will be boosted every 6 months. Now that doesn't give ideal protection. If you wanted to keep the horse's level of protection at a actual sort of optimum level, you would vaccinate every 3 months, but this is too expensive and too impractical. But if you've got a horse that's perhaps likely to be taking part in the Olympics later this year, then you might want to vaccinate it every 3 months. But for most people, vaccinating in 3 months isn't appropriate, and 6 months is the suggested compromise. Now, fortunately, if you vaccinate a horse in the face of an outbreak that hasn't been vaccinated in the last 3 months, its immune level will go back up to protective levels within 24 hours. So this is the suggested advice that if there's an outbreak nearby or an outbreak in the yard and you've managed to divide the horses into sort of affected and in contacts and those that haven't had any contact, then you could revaccinate the safer group if they haven't been vaccinated in the last 3 months and boost their immunity. Just another sort of slightly interesting statistic about the vaccine. We often get asked how effective it is. Well, the company produced data that suggests that 75% of horses will get protective levels of immunity, which is pretty good for any vaccine. There's no sort of direct data as to its efficacy in terms of a sort of big field trial, but there is some indirect data, and that comes from the Animal Health Trust's returns, where they produce some yearly figures on the number of positive results they get to various diseases, that are samples that are submitted to them over the year. And the few years before the vaccine was introduced, their number of positive swabs was ticking around somewhere around sort of 215, 220, 230, something like that. The year after the vaccine was introduced, and it did sell quite well, they sold over 55,000 doses of it, that number fell to just over 100 and stayed there while the vaccine was on the market. And then after the vaccine was taken off the market again, the following year it rose to over 500 and has then steadily come back to this sort of low 200s again. So it'll be very interesting to look at those figures now the vaccine is back on the market and see if a similar decline happens this time. So just thinking a bit about taking new horses into a yard. If we look at horses that haven't, assuming they haven't been previously vaccinated, if you've got a zero tolerance and eradication policy, what we would suggest is that the horses are quarantined. The ideal period is 3 weeks. The period of 3 weeks is that that will give you probably about 95% of horses that are likely to be incubating the disease, if they're going to show any clinical signs, they will show it within that period. That falls to about 80% with 2 weeks. So you do miss a reasonable number of horses just confining for 2 weeks, which is why we've gone to change our policy. So you'd quarantine them, you would do serology on them, you take a blood sample, measure antibody to Strangle's organism, and if they come up negative to the serology test, then those horses would not need any further tests doing, and those could be, after their quarantine period, could be admitted to the herd. And then if you depending on your risk assessment, you decide whether you then go on and vaccinate them or not. If they come up positive to the serology, that suggests that that horse has encountered the Strangle's organism sometime in the last 6 months. It may be a carrier, or it may have just had mild form of disease, but it has encountered the bug at some point and seroconverted, produced an antibody response. If that's the case, you want to know whether it is actually a carrier or not. And the best, well, there's 2 ways of doing this. One is to take a guttural pouch lavage, so put an endoscope up the horse's nose, put a catheter down the endoscope, squirt some sterile saline into the guttural pouch, let it mix around for a while, and then retrieve it, plate it out and culture it, and do a test called PCR on it to try and identify the Strangle's organism. And that is really the sort of gold standard test that will give you the sort of best chance of picking it up. The other way of doing it is to take nasopharyngeal swabs, where you get a thing like a industrial sized cotton bud and shove it up the horse's nose right up to its throat, leave it there for 30 seconds or so, and then do culture and PCR on the secretions that you collect with that. But horses don't tolerate that ever so well. Some of them have to be done under sedation, and the other thing is that it needs doing 3 times, because statistically speaking, if you do 1 nasopharyngeal swab, you've probably got around about, I think it's about 60% chance of picking up a positive horse. If you do 2 nasopharyngeal swabs at weekly intervals, you'll increase that to somewhere around 80%, and if you do 3 at weekly intervals, you will increase your chance of picking up a positive case to about 95–96%. Now, if you're in the tolerance camp, so you're not going to try and eradicate it, you're going to try and live with it. Again, you may, if your risk acceptance is fairly low, still go down the quarantine, serology and testing the positives, and then finding out which ones are negative and vaccinating them, treating any positive ones that might be carriers. Or if your risk acceptance is quite high, you might just quarantine them for 2 or 3 weeks, and then when they're out of quarantine, if they haven't shown any clinical signs, you'll just vaccinate them and add them to the herd. So again, depends on your risk acceptance and your tolerance or non-tolerance approach. So just to summarise this part of the talk, Strangles is very common. It's quite underdiagnosed. We're trying to raise awareness of it, but a lot of the time when people say, "Oh, my horse has just got a cold, or he's a bit of a snotty nose, and I think it might be the hay," and this sort of thing, a proportion of those will be Strangles. You've got to think of the carriers as the Trojan horses. Those can come into a yard and start an outbreak, and it can be quite difficult sometimes to impossible to identify them without specifically testing to it, but very, very difficult to know that your horse is a carrier. Good biosecurity measures are vital for control, and you need to decide whether you're going to have a tolerance or a zero tolerance approach. Vaccination will help control the disease in higher risk yards, but in lower risk yards it is not necessary to vaccinate. Has anybody got any questions on the first part there before I go on to managing outbreaks? Yeah, well, we're hoping we're going to be able to put this on the website for one thing, and I can direct you to another website that gives a lot of this information as well. So if you want to drop us an email, we can send you the links to those. Okay. Anybody got any other questions? Well, the sort of evidence we've had when it was on the market before is that it is effective, but it is only effective if people use it properly and are doing sufficient numbers of horses in the yard. I mean, yes, if you're the only one in the yard that wants to vaccinate your horse, you will give some protection. But if you've got a lot of horses around you that aren't vaccinated, you get an outbreak and they're shedding lots and lots of strangles organisms, then vaccinated horses can be overwhelmed by the sort of onslaught of infection they're imposed to. And that's the same with any vaccine in any species, the same with flu vaccine. And the amount of horses that are vaccinated against flu in this country, again, will vary very much from yard to yard. Some yards you go into, nobody vaccinates at all. They barely even vaccinate for tetanus, and others they'll vaccinate religiously. But the overall estimate of the number of horses vaccinated for flu in this country is only 38%, and tetanus is actually surprisingly lower. So people that vaccinate for flu will vaccinate for tetanus, but there's even smaller number vaccinated against tetanus. Well, ideally you get that figure up to 70%. But yeah, if you're getting 50% that will do it, then that would that would be great. Yeah. If you're in a yard where I know you're in, one barn hiker, if you could persuade the people in that barn that your horse is obviously coming into more direct contact to vaccinate, then you might be able to protect your little area without. Yeah. Any further questions? Yeah. You could certainly ask that. I mean, it's entirely up to livery yard owners, what policies they, they want to put in place. Yes, yes. Very much so, yeah. You could ask for a veterinary history. You could ask for a veterinary history before you admitted people. Might put some people off, but for the people that actually want their horses fit and healthy, that might not be a bad idea. Yeah. 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 No, that's certainly something that could be done, and certainly as a veterinary practice, we obviously as long as the owner of the horse gave permission, because there is a patient confidentiality matter there. But as long as the owner gives permission, then there's no reason why we couldn't release records to to a livery yard to say that they'd either been vaccinated or not, or whether or not they'd been on a yard that had strangles outbreak in the past. I mean, you can partly circumvent that with your quarantine and serology testing. It could do, but it wouldn't guarantee, just because there's no record in the medical records for that horse that they're not a strangles carrier. Yeah, yeah, that's right. I mean, the other thing you can do, which I know of some yards are starting to do now, is say that before they set foot on the place, they've got to provide you with a negative strangles serology test. That's a real zero tolerance approach. But if you have your horse tested and it comes back positive, and you don't even get to bring it through the gates, and that's another way of looking at it. Yeah. Mm-hmm. Right, at the moment there is no differentiation between wild strain and vaccine strain without going to more of a sort of research approach, but they are working on that. So yeah, a negative serology result in a vaccinated horse would suggest that it either hasn't responded to the vaccine or it's been too long since it's been vaccinated. But yes, if using the vaccine does remove that sort of armament from our diagnostic toolbox, which I was just going to talk about, brings us a nice link on the toolboxes now. Any further questions? Yes, okay. That's nonsense. Short, to put it shortly and sweetly. Yes, disease is worse in youngsters and in older horses, but horses of all ages can get strangles. The sort of short answer is no. It's not a reportable or a notifiable disease, and we as vets are bound by sort of confidentiality for our patients and owners. So if someone wants us to not tell anybody that their horse has got strangles, then unfortunately we are bound to not do that. We will do our utmost to advise them otherwise, because it is not in the welfare of their horses or the horses around them, not in their interest to do that. But ultimately we can't go around and publish a list of sites that have got strangles. Unfortunately, I wish we could. We do rely with this on people being open and honest, and one of the messages that we need to get across to people is that it really doesn't do your reputation as a yard, and doesn't do running your yard any favours if you're not honest about this. If you get a suspected outbreak, the best thing you can do is put your hand up and say, right, we've got a problem and we need to deal with it. And if one of the things that I'm just going to go into in a minute is sort of setting up obviously protocols for horses coming onto yards to try and get it onto the yard. But once you've actually got an outbreak, it's a very good idea to have a protocol in place as to what happens then, so that all the horses on the yard and all the owners of the horses on the yard know exactly what's going to happen if you do get a strangles outbreak. And if they've got a copy of that available when they come to join you, or if it's in your livery contract about what will happen and what will kick into place, and whether the yard's going to be closed, etc., etc., then nobody can argue about it, because this does cause a lot of problems and a lot of grief and a lot of incentive for people to sort of cover it up when they start thinking that the yard's going to be closed down and they can't go to any competitions for some time. Right, we'll have another opportunity for questions in a little while. I just want to quickly zip round, so I don't want to keep here all night, about what we try and do when we're dealing with an outbreak. And we consider this as a sort of toolbox, and we've got these various areas that we use within that toolbox. And the first one is information, which is very important. So things like the history of the horse, when did it get sick, has it been sick before, has it had any previous problems, whether there's any other horses on the yard that have got problems, whether the yard's had strangles outbreaks in the past, how the yard's managed, whether there's things like quarantine protocols in place, that sort of thing. Obviously the physical examination of the horse, listening to what the owner's actually telling you, and does it fit in with classical strangles or atypical strangles. Does the management system suggest strangles as a possibility? If you've got a horse where everything's being thoroughly isolated and tested, it's less likely than one where horses just walk in the yard and get shoved in the first available box. what's the current local and national situation for strangles? At the moment, alarm bells are ringing in my head when people start talking about horse with a snotty nose. There's a lot of strangles about. So, you know, the sort of local current situation is important. Are the clinical signs consistent with strangles? If it looks like strangles, it probably is strangles. Just thinking and giving you an example of the history, I just throw this little scenario at you. Livery yard with that's been long established. A lot of the clients have been there for quite a long time. The livery owner has an old retired horse which is very good with other horses and tends to get shoved out with any new horses that arrive. They get a vacancy come up, and the young girl brings her fairly recently acquired horse into the yard. It's fit and healthy when it arrives, goes out in the yard with this in the field with this old horse, and after about a week it starts to go off its food a bit. Next morning it's got a snotty nose and is coughing, and 2 or 3 days after that it's developing swellings under its jaw. So the livery yard owner has a slight fit, calls the vet, takes a nasopharyngeal swab, and it comes back positive for strangles. Would anybody like to venture to me where this outbreak's come from? Sorry? Yeah, you're quite right. I didn't know that. It wasn't your yard, was it? Right, now exactly that. I mean, most people would have said, oh, it's the, you know, it's the horse, she's recently bought it, didn't know where it came from, she's brought it onto the yard, and that was the reaction of the people in this particular yard. In actual fact, it was this poor old boy that had been on the yard for donkey's years, and he was a carrier. So the history of the outbreak is important, but we do need to not make assumptions and, you know, sort of dig a bit deeper when we're trying to find the source of these things, which can be quite important. Communication is the next tool in the box, and that is very, very important, and it's very important that we get open two-way communication, that we identify the key players like yard managers, livery yard owners. It's a good idea to have some sort of yard conference to either just amongst yourselves in the yard, owners and livery owners, or possibly with your vet. Certainly something, you know, we're amenable to doing, and agree your strategy for dealing with disease and your strategy for admitting new horses. So work out your control plans, get everybody to buy into that, and then disseminate the information to everybody involved. Diagnostic tests. Now, this is an area where over the years I have seen more money wasted than probably anything else, with inappropriate tests being done at the wrong times on inappropriate animals. There's an outbreak that I was involved with not so long ago, where another practice was coming in and they were doing guttural pouch lavages. They were doing 3 of them rather than 1, and they were doing it while, unfortunately, horses sort of next door to these horses that were being scoped, you know, a couple of days later were coming down with clinical signs. So you know, that was just an example of you know, inappropriate tests being done at a time when it just wasn't appropriate, and it was a complete waste of everybody's money. So it's, you know, there's a lot that can be done, but it needs careful planning. So you're doing it at the right time, you're testing the right animals, and you're taking the right samples. And there's quite a few different things we can do. Interpretation is quite can be quite difficult sometimes, and we also need to think about the specificity and sensitivity of tests. That's the false positives and false negatives that we can get in these tests. Because please, if there's one take-home message tonight, don't go away with the impression that we can come and shove a swab up your horse's nose or take a blood sample and give you an absolutely definitive answer as to whether or not it's got strangles. Because I'm afraid it isn't like that, and it isn't like that for the majority of biological tests we use for any disease. The gold standard for diagnosis is if we can grow the bug. So we'll deal with culture first, and as I said before, we can take nasopharyngeal swabs or nasal swabs to less yield, sort of less sensitive information, or guttural pouch lavages. We grow up the organism on plates, separate the colonies out, and identify them under the microscope, and identify the species using various biochemical tests. You do need sufficient live bacteria to do these tests, these biochemical tests, to actually identify the organism. And false negative results are very common, and it might be that only 50% of the swabs that you take from horses that have actually got snotty nose, high temperature, big draining abscesses, even if you make a hole in the abscess, stick a swab in it and get a good dollop of pus, you might only get 50% of those swabs coming up positive, which is obviously not a fairly low number, and not very rewarding. A slightly more sensitive test is what we call PCR, and instead of looking for live bacteria, this is looking for the bacterial DNA. And we're looking for very targeted sequences, and it will find either live bacteria dead DNA or dead bacteria dead DNA. It's a very rapid test. It can be done in a matter of hours rather than several days, and in ideal conditions it is very sensitive, over 90% sensitive, but the sensitivity is reduced in clinical samples, and this is a problem when we're dealing with pus. If we're dealing with a bacteriology plate with bugs growing on it, it's quite easy to do tests on those and get positive results. But if you're dealing with pus, which is a lot of white blood cells, chemicals, devitalized tissue, and a few bugs, that becomes a bit more difficult. So we've got to bear in mind that we're dealing with real live clinical material here, not stuff in a laboratory. It's very isolated. So interpreting the results, if we've got a culture positive horse with a positive PCR, that's a no-brainer, it's infected. If we've got a culture positive and a PCR negative, that's a no-brainer, because we've grown the bug, we know it's there, and that's infected. Now, this group here, some time ago, people used to say, well, if it's come up PCR positive, but you haven't grown anything, then, it's quite likely not to be infected. But in actual fact, the PCRs are much more positive, much more sensitive test than the culture. So we now regard most of these horses as infected. And then the ones that come up as culture negative and PCR negative, we assume those aren't infected, but the best we can say is they're probably not infected. They're definitely not infected. Now, this is just a slightly worrying illustration of an outbreak. Now, I think this was in Holland, which was written up in the Equine Veterinary Journal about 6 years ago. This is one barn in a big livery yard, 17 horses, and the guys that did this work were able to take culture. They used nasopharyngeal swabs, and they did culture and PCR every week for 15 weeks to follow this outbreak through. Now, the group at the bottom here, horses 13 to 17, these are the horses that showed clinical signs. So these horses had fevers, they had snotty noses, or they had draining abscesses around their head and neck. Now, if we look at horse 17, week 1 and week 2, PCR positive, that's the pluses, the PCR positives. The C's are culture positive. So PCR positive, culture positive, weeks 1 and 2. Brilliant. That one played the game. And then remained PCR positive for up to 9 weeks afterwards. Horse 16, PCR positive, culture positive. Fantastic. The tests have done their job there. A couple more positives there. Horse 14, first week, didn't get any positive results. Okay, well, we might have been unlucky there. Weeks 2 and 3, culture positive, PCR positive. Great. Well, what about horse 15? This has got fever and draining abscesses. Week 1, week 2, week 3, week 4, nothing. Week 5 comes up with a positive PCR, nothing after that. Horse 13, 1 positive PCR at week 1, and then nothing. And then, more worryingly, we look at the other group. These are the horses showing no clinical signs whatsoever. Horse 4 at week 2, that's culture positive and PCR positive, so we know that's got strangles. Horse 10, week 3, culture positive, PCR positive, we know that's got strangles. But then look at all these other pluses. There's only horse 12, 9, 6 and 2 that through that 15-week period didn't come up with any positive results. So that means that out of 17 horses, if you just looked at clinical signs, you'd think there were 5 of them had strangles and the rest had got away with it. If we look at all the laboratory data, and they've done a hell of a lot more investigative work than we would normally do in a yard, then out of those 17 horses, only 4 weren't proved to have encountered strangles. So that, I think, illustrates very well the insidious spread of the atypical or mild form of the disease, and you know, can show you that even though you think you've got an outbreak contained and you've got away with it, then the importance of identifying these horses to whether or not they've come up positive to these tests, and you know, potentially identifying carriers, because we've got 8 out of these 12 horses will have assumed to have not had strangles based on clinical signs, and probably up to 10% of those could go on to be carriers. So the strangles blood test, there are various ones of these available now. Probably the most reported one is the one that was has been set up for a while from the Animal Health Trust, and now tests 2 proteins, 2 strep equi proteins that are called A and C, and the sensitivity of the test, that's the number of positive horses that would come up positive, is over 90%, which is very good for any biological test. And the specificity, the number of negative horses that would come up negative, is 88%. So it's a pretty accurate test as far as biological tests are concerned. And with both of these proteins, if we get a level of 0.5 or above, then those are known to be positive. So next tool in the box is taking advice. Where do we go for advice? Not just you guys, but where do we go for advice as well? We'll talk to people in universities and you know, possibly medical specialists in other practices. We will talk to the Animal Health Trust for advice if we've got a weird sort of outbreak occurring and we need some help sorting out the epidemiology of the outbreak. And we'll talk to the manufacturers of the strangles vaccine, NSD, who will be very helpful in you know, helping us get to the bottom of some of these things. Basically, because they want to flog us some vaccine, but at least they're giving us some help. So we need to know who to speak to and what questions to advise and to ask and how to implement the advice that's given. Outbreak control. We've talked about biosecurity, a little bit about surveillance on incoming horses and testing. We've gone through some of the tests that can be used. It's important, if we do get an outbreak, to control the movement of both people and animals. It's not just the animals that can spread it. You can spread it on your clothes, on your boots, and on equipment, particularly head collars, feed buckets, and particularly water buckets. And when we're thinking about control of an outbreak, we can use this information for how do I stop my horse getting strangled, as fun take this to shows. And one of the bits of advice I always say to people is to take your own water supply with you and your own bucket. And if somebody comes up to you and says, "Oh, can I borrow your water bucket, please?" you say, "Actually, no, I'm sorry, you'll have to go and ask somebody else," because you don't know where their horse has been, and you know, all good intentions and you want to be helpful and what have you, but if they go off with your water bucket and give their horse a drink, and then they bring it back to you plastered in Strangles organism, then your horse is going to pick up Strangles just because you've been kind to somebody and help them. So if you really don't want your horse to get Strangles, take your own water supply and don't lend sort of buckets and things to other people. Don't go around touching other horses at shows. Again, you can sort of get secretions on your clothes and hands, and try and avoid people doing that. I know that can be difficult if you've got your horse tied up to the lorry and you've got to nip to the loo or go and get changed or something like that. But if you can try and stop people touching your horse, it may be that you put a laminated notice on the side of your lorry next to your horse saying this horse bites, do not touch, or something like that. That's quite effective usually. But when we're talking about segregating animals in yards, we try and develop a sort of traffic light system, and we divide the horses into red, amber and green. Now the red horses are the horses with obvious clinical signs, and they're the ones with temperatures, nasal discharges, abscesses, etc. The amber ones are the ones without clinical signs, but they've been sharing a water source with the affected horses, or they're in the same field, or they're in the same barn. The ones that are in the green group are the ones that have had no direct contact at all with the red and the amber groups. So you've got infected, you've got in contact, and you've got not exposed. And you want to keep those groups as separate as you possibly can. So no personnel going from one group to the other, or if they are, they go to the not exposed first, then they go to the in contact, then they go to the infected. But ideally you want to prevent that. You get people that are dealing with the infected ones to deal with them and then go home, or go somewhere and change. If we get called out to a yard that has got Strangles, we've got to deal with potentially infected animals, we will try and plan the call at the end of the day so that we go there and then we come back or go home and we can get changed, get showered, disinfect our equipment, what have you. If that's not possible for some reason, then we will allow ourselves a gap in the day such that we can disinfect during the course of the day. And the same will be true of farriers and dentists and what have you. If they're going into a yard where there's a suspected problem, then they will try and come to you at the end of the day and disinfect afterwards. And it's very, very important that you let your farrier and your dentist know, particularly your dentist, as he's sticking things in horses' mouths, that there is a potential problem on the yard, and then they can arrange their day accordingly. Just on a practical note, when we're thinking about these red, amber and green groups, it's quite handy to go and get yourself 3 rolls of insulating tape, different colours, and you go around and you label all the water buckets, feed buckets, head collars, clothing if necessary, lead ropes, wheelbarrows, forks, so that equipment just stays with that group and someone doesn't pick up the wrong head collar one day and spread Strangles on the head collar or lead rope from the infected group to the not exposed group, which can be a bit of a disaster if you've got sort of 5 or 6 weeks down the line and then somebody does something like that. Be prepared to move horses between the groups on the result of any surveillance and testing, and then we've got to decide when the outbreak is actually over and we want to then screen for carriers. There's no point in screening for them early on, and the advice at the moment is that you wait 6 weeks after the last clinical case is resolved and then you test for carriers. And how do we test for carriers? We'd start off by taking a serology blood from every horse that hasn't shown clinical signs. Obviously the ones that have shown clinical signs, we know they're going to be positive anyway, so we don't bother doing those. But all the other horses, we'll test those, and the ones that come up negative, we know those horses have got a over 90% chance of being safe, so we can kind of eliminate those. And then the ones that come up positive, we can then go on to do guttural pouch lavages and or nasopharyngeal swabs and test to see whether they're positive or negative. The ones that come up negative, again, you can move those into another sort of fairly safe group. Anything that comes up positive, then needs treatment. If you've got infection in the guttural pouches, we can treat those by instilling antibiotics, usually in gelatin, to make a sort of slow release preparation into the guttural pouches, and then after a couple of weeks we will test again and see if they're then negative. Horses with that are carriers and have chondroids in their guttural pouches, they will on average take 2 or 3 treatments to get them clear. So that's how we'd screen for carriers, how we'd treat carriers, and how we divide the horses up. In terms of, if you remember one of my first slides, if you remember back all that time where we had the arrows, and I said there was this window of opportunity to nip things in the bud. That is the small delay of 2 or 3 days between the horse contracting strangles and actually spiking a fever and starting to shed bacteria. Now, if you monitor your horse's temperatures when you've got an outbreak, and you need to be doing this at least twice a day. If you're only going to do it once a day, you might as well not bother, because a lot of these horses will only spike a temperature for a few hours and you don't want to miss it. But if you monitor their temperatures, then you can pick up these horses that are starting with the disease very early, and then if you get that happen, we bang them on penicillin, and we can be very effective at stopping the disease progressing any further if we get them on antibiotics in the early stages like that. So management changes for preventing things we talked about a bit, vaccination, and then outbreak control plans, making everybody aware of what you're trying to do, developing a policy on closing the yard and movement restrictions, and making sure that before you get the outbreak everybody knows what's going to happen and are bought into this, making sure that there's lines of communication and that somebody's in charge and can make decisions, identifying the isolation areas and zoning them, and then, as I said, labelling equipment, making sure that people aren't going from one zone to the other, and screening for carriers at the end of the outbreak. So, any further questions on any of those matters? No. They can shed. A carrier, as we said before, is a horse that sheds bacteria for more than 6 weeks. Now, they can self-resolve, and they can sometimes resolve after a number of weeks or a number of months, but they can go on for years and years and years. Those are the ones that go on for years have usually got those chondroids in the guttural pouches. If we do identify a carrier, we can remove the chondroids, and we can put antibiotics into the guttural pouches and then retest to try and clear them up. Years ago, not so many years ago, if you had a strangles carrier that was identified, they very often got put down. But these days there are some treatment options for those. Any further questions? Hiya. I'll just tell you about that in a minute, if I may. All right. I'll go into that in a second. Any other questions about strangles, outbreak management, or anything else? No? Right. Okay. Mimi, could you pop through into the middle bit there and just put the arena lights on? Just by the workshop door. You can find your way around there. Oh, how have we done that? Thanks. Don't quite know how you managed that from there, but right. Okay. Obviously, we as a practice are aware that we're in a bit of a time of austerity at the moment. Everything's going up, particularly sort of fuel costs, credit squeeze. There's reports of horse abandonments increasing, feed prices are going up, etc., etc. And we wanted to try and think of ways that we could try and help our clients and horse owners in general. part of that is things like this, you know, sort of educational things, trying to help people reduce unnecessary spending, giving you advice on support and particularly sort of preventive health schemes, because it's always better to try and prevent things happening rather than picking up the pieces afterwards. So we've put together a few packages that we're just launching at the moment. One of them is this Strangles initiative. We do get more outbreaks at this time of year. We have got a number of outbreaks going on, and one of the things is talking to people about admission and outbreak plans. So if anybody would like to talk to us about that, you know, do get in touch, and we'll, you know, give you some help putting those together. With the help from NSD that make the vaccine, they've very generously sponsored some special offers on this across the country. Normal price of the vaccine is just under £30 plus VAT, and for our clients we're reducing this to £20 plus VAT. Now on top from middle of March to middle of April, on top of this, through this next month as well, we've got a vaccination amnesty. Now this isn't just for strangles, it's for tetanus, flu and tetanus, strangles vaccine and EHV if anybody's interested in that. This will actually be running to the end of April rather than the middle of April, and it's to encourage herd immunity. We were talking about earlier, getting more people to vaccinate in the yard. For people that vaccinations have run out, or you know, their horses have never been vaccinated, to try and encourage more people to vaccinate. So basically, you pay for the first dose, and I'll say there's a third off the Strangles vaccine at the moment as well, and the second dose is free of charge. The pharmaceutical company will pay for that. Doesn't apply for visit charges, but if we're doing more than 6 horses at a time in a yard, then we will do the visit for free as well. So if anybody wants any more information on that, or would like to you know, take us up on that, then obviously get in touch. The other thing is a laminitis initiative. Obesity in horses in the country is at epidemic proportions. It's a major problem. We've got away with it the last couple of years because we've had a fairly bad winter, particularly last year, followed by a very dry spring. Now, I've just been told this afternoon by somebody that there's no rain forecast for the next 15 days, so it might be that we're going to get away with it a little bit this year, but we are seeing a lot of sort of minor colic, and we have seen quite a few laminitis cases already. Now the temperature has gone up above 8 degrees. We have a imminent laminitis alert because the ground has been reasonably wet. It is drying out rapidly, but as soon as the grass grows, we will have you know, an absolute epidemic of laminitis if we do get some rain. And most of this is due to horses which are obese, which now make up 70 to 80% of our horse population in this country. Obesity causes insulin resistance, and we now know that 80% of laminitis is due to insulin resistance. Now, on Tuesday the 3rd, we've got the BHS and Spillers coming here to do a horse weighing and advice day. There'll be one of us on duty as well, doing sort of vaccinations, microchips, and you know, sort of looking at sort of minor ailments and things. But Spillers will be bringing their weigh bridge. They'll be weighing anybody's horse. If you want to bring your horse along, they'll fat score it. They'll teach you how to fat score, and they'll give you some nutritional advice as well. The BHS will also be on hand to answer any questions about BHS. And then on Wednesday the 11th, we'll be advertising this shortly through posters and on our website. Graham Harland is coming to see us again to do another laminitis dissection, and we'll be doing a talk on laminitis. And we've also got somebody that deals with human type 2 diabetes coming to talk to us to do some comparative human equine sort of discussions which are quite interesting. I was very amazed to hear that people can actually get laminitis as well, and there is a syndrome that affects the feet of people with type 2 diabetes, which is very interesting. So really looking forward to hearing more about that. We will also arrange any livery yards to do a yard visit either with Spillers or Dodson Horrell, and we'll arrange for it to come out and bring Weybridge to fat score and nutritional advice. And during April, we're also knocking 35% off the cost of insulin and Cushing's blood tests. Now, one of the other ways you might be able to save yourself some money is to insure your horse against veterinary fees. Do you have veterinary fee insurance cover? We're still recommending that people should. However, there are a lot of changes in the market at the moment, and you do need to be increasingly careful and reading the small print of what level of cover you've got and what conditions are excluded, because two of the major players in the insurance market are likely to leave the insurance market fairly soon. There's a lot of hoo-ha in the press at the moment about such as Halifax that have got into small animal pet insurance and offered these whole of life cover policies which they've realised were ridiculous and are now trying to get out of them. There's one or two, as I say, the major players in equine veterinary fee insurance who have basically got themselves into trouble and have massively altered their terms and conditions, so you need to be aware of that and look at what you're paying for. You'll find that more exclusions and more broader exclusions will be applied, and it's a good idea to look at things like your level of cover and what sort of excess you've got. If you've got a fixed excess, you know what you're paying for, and it can be 120, 130 quid, 150 quid, maybe a bit older. Older horses might be a bit more. There are one or two companies, however, that will say that you've got to pay 17.5% of whatever the claim is. Now, if you're looking at sending your horse for colic surgery and you think you've got it insured and that's going to pay for it, and you suddenly got to find 17.5% of £3,000 or £4,000, that's quite a lot of money. So just have a look at your policy and sort of see how how that affects you, and try and plan on make a bit of a sort of disaster plan, as it were, and work out how you pay an expected bill. Now, I've been speaking to a few of our clients about this, and as a result of some of the sort of discussions I've had with them, we've decided we're going to set up an equine savings plan for people to put money aside for their horses in the event of having an unexpected bill. And it's very simple. You can save a regular amount each month by standing order. You choose the amount as long as it's in multiples of £5, and you're basically putting aside a reserve that can be used to pay any unexpected bills. We're not going to tie you up in some sort of 90-day access or anything like that. It will be rapid access. If you need the money for something else within a day or two, we can transfer it back to you by backs. But some people have said that would be of use to them and find that helpful. And that will be available from the beginning of next month. Again, if you're interested in that, do let us know. Livery yards now. For selected yards, we're going to be setting up a scheme where we will do a free of charge routine visit once a month on a regular date. So it might be, I don't know, the third Wednesday of each month or something like that. Other visits where we're seeing 6 or more clients at the same time will also be free of charge for those yards. And we will also set up strategic worming programs for you. So we're getting you looking at fecal egg count results rather than worming everything in the yard, which will save you quite a lot of money in worming horses that don't actually need worming, and will also be better for preventing resistance to wormers. We can also look at preventive healthcare schemes such as vaccinations, dentistry, and that sort of thing. We'll look at your disease and first aid arrangements. If you want to do lectures doing for your liveries on these subjects, we can arrange to do those as well. And we're also doing a yard visit and health check offer, which I'll go into in a second. We would also like to establish in each yard a liaison person, so basically a point of contact to improve our communication with livery yards. So somebody that we can perhaps get to give us a ring a few days before the routine visit and tell us what we've got coming up, so we can put aside appropriate amount of time and decide what sort of equipment we need to take with us. Somebody that we can email out details of any disease alerts or any events that we've got on here and that sort of thing, and they can communicate those to the other liveries. So the other thing we're offering at the moment is to come and do an afternoon yard visit, and we will arrange for a weighbridge to be brought along if you want that, and we'll weigh everything, we'll fact score everything, we'll look at horses' passports and make sure their vaccinations are up to date and advise you on anything that needs doing there. We'll make sure that you're all legal and you've all signed your Section 9s and your medical control pages. Seeing lots of blank faces here. Does anybody know what your Section 9 in your passport is? Put your hands up if you know what it is. Yep, 2, right, okay. Right, Section 9 is the declaration that you have to sign by law to say whether or not your horse is intended for human consumption or not. This has to be signed because, in theory, every time we look at your horse, we're supposed to look at your passport and see whether it's been signed or not, and that does limit the drugs that we can use in your horses. So if you were to get stopped by the local authorities for a weight check or something like that, and they examined your passports, which I know doesn't happen very often, then in theory you could get done for not having that signed. I think in practice it's probably unlikely unless you're a repeat offender. We'll also do a health check, which these are annual health checks that we're also bringing in. The cost of that would normally be 45, but we're going to bring this down to a nominal £10 a horse for these afternoon yard visits, and that involves physical examination. We'll have a look at their teeth and see if there's anything needs doing to them. We'll listen to their hearts, we'll look at their eyes, we'll trot them up, see if they're lame, we'll look at their feet and their shoeing and advise on that, and as I say, we'll check passports and things, and we'll give you a short questionnaire to fill in about the horse's health as well. Preventive health schemes, we've talked a little bit. We're going to be launching these fairly soon, where we'll basically have all your regular care in one package. There'll be different levels of cover available. You'll have a peace of mind to know that everything's taken care of and is taken care of at the appropriate time, and you'll have reminders to tell you when things need doing. Hopefully it will allow us to detect problems earlier and allow sort of easier and less costly treatment, and hopefully you'll have the benefit of knowing your horse is fit and healthy to ride, and these will be payable either quarterly or monthly, and you will actually sort of get a discount on the normal individual service prices. Right, I think that is all I wanted to say. I'd like to thank you all very much indeed for coming this evening. If anybody's got any questions about any of those schemes that we've raised there, or if you've got any more questions about strangles, please do get in touch with us either by email or give us a ring.